Hello everyone, very warm welcome to Department of Surgery here at Shalamar Medical and Dental College and Shalamar Hospital. Shalamar Surgical Intern Training Program is a structured program which we will guide you through, and this will be an important component of your clinical as well as surgical training. It will encompass many of the aspects related to your surgical training, your effective training, and your psychomotor training. It is a well-organized, structured clinical program which will be run through a medium which is called Shalamar E-Learning Management System or SALMS. Many of you will be familiar with this Moodle-based learning setup. However, the people who don't know about it will learn through it as the time goes by and they go through this process. I will introduce Shalamar as well as Department of Surgery briefly first, and then we will move on with the particulars of this program. Shalamar Hospital is committed in the delivery of its tripartite mission of exemplary patient care, high impact research and education. Over the last 44 years, Shalamar Hospital has evolved into a premier tertiary care medical facility with 500 beds and 25 clinical departments and specialties equipped with world-class diagnostic and treatment facilities. We aim to drive forward the strategic partnership between all complementary units to development and enhance intellectual rigor, practical clinical skills required to work in diverse settings, and instill a deep commitment to patient welfare. Shalamar Department of Surgery, I will introduce a little bit about it. Shalamar Hospital offers notable general surgical services with high volume endocrine, thyroid, parathyroid and adrenal gland and cancer surgery services. Currently, we are the largest endocrine surgical facility within Pakistan with annual procedure rate of around 200 per surgeon, which is almost double the volume of any tertiary UK facility. People from across Pakistan are referred to us for endocrine consults and surgeries. In mere 4 to 5 years, the surgery department has done around 2,000 endocrine and oncological surgeries. One of the teams is led by renowned surgeon Professor Shalamar Hospital and Dr. Talat Waseem. Myself, Professor Tausif Asghar has interest in laparoscopic and in GI surgery. Professor Hamad Naeem Rana is heading Unit 2 along with Dr. Rizwan, Dr. Mazul Hassan and Dr. Sadaf, and have special interest in laparoscopic, perineal and breast surgery. Shalamar Hospital is also proud to facilitate the largest number of bariatric surgeries as well as by Dr. Mazul Hassan. Moreover, surgery department offers general procedure services and firmly believes in patient satisfaction. Shalamar Hospital is proud to lead the field of endocrine surgery, surgical oncology, and bariatric surgery. Here are the faculty members. Most of you already know about them. Professor FRCSEng, Professor Hamad Naeem Rana, Professor Tausif Asghar, Dr. Rizwan Khan, Dr. Sadaf Isaac, Dr. Mazul Hassan, and finally myself. Surgical research is the basic concept which is being carried out in surgery department. Surgical department is also excelling in research. For example, in 2000 alone, it had 8 working sessions at the international conference held in Shalamar Medical and Dental College. In 2018 international conference, 25 research papers were presented, and the upcoming 2020 international conference, 13 interns and students will present their research work. The commitment to research activity is bearing fruits now. Shalamar Institute is proud to be the resident institute of Pakistan Endocrine and Thyroid Surgeon Association, PETSA, and Professor Khwaja Muhammad Azim is currently the president of this prestigious society. Pakistan Endocrine and Thyroid Surgeon Association is currently collaborating with Asia Pacific Thyroid Surgery Association. Professor Khwaja Azim also represents Pakistan in this prestigious international forum. Graduate and postgraduate teaching and learning are the strengths of the Department of Surgery. The Department of Surgery is committed to excellence in the student and postgraduate education as well. At SMDC, Surgical Department has helped establish e-learning systems, Shalamar e-learning management systems, and is offering virtual courses for students and professionals alike. In current COVID crisis, this system has helped the institute a lot. A website, Shalamar Surgeomics, has been launched to facilitate student learning. The knowledge products exclusively of the surgery department have been recently published in Journal of American College of Surgeons and American Journal of Cancer Case Reports. Let me introduce you to your rotation plan. For 12 weeks, you will be staying in Department of Surgery and Allied. For 8 weeks, you will be circulating within the surgery department, either in Unit 1 or Unit 2. And for 2 weeks, you will be going to anesthesia, and for 2 weeks, you will be going to radiology department. This plan is to ensure that you have adequate knowledge of anesthesia as well as radiology in terms of training. And they are important. Why? Because these are the basics components which govern your ATLS requirements and BLS requirements as well. So it is very important for you to train in anesthesia and radiology as well, apart from the surgical training. Successful intern is the one who pays a lot of attention, does his work very hard, listens, asks questions, is respectful, participates in all of the activities, takes notes, stays out of trouble, studies a lot, he is willing or keen to learn, he is on time, determined, he follows the directions, he has a positive attitude, he is organized, he is known to have the capability of time management and his self-management as well. He has excellent communication skills, and he also, on the way of training, develops leadership skills. So our Shalamar Surgical Intern Training Program is actually based on the PMDC's 8 domains of a graduate outcomes. So these 8 domains are patient safety and quality of patient care, relating to the patients, communications and interpersonal skills, collaboration and teamwork, management including self-management, scholarship, professionalism, and clinical skills. These all 8 things join together to make one good medical doctor. It is our entire effort to put a lot of effort into your training so that you achieve all of those 8 domains. So the principal objectives of your intern training are: one is the clinical training, and second is the clinical education. Clinical training incorporates both formal teaching of clinical skills and more informal training that occurs as part of clinical service. It is through this combination that the intern gains the necessary skills such as basic life support, appropriate clinical note keeping, phlebotomy, cannulation, training of informed consent, assisting in the operation theatre, passing the tubes like Foley's catheter, NG, etc. Apart from that, in surgery is an extensive subject and is it is important that the intern continues to learn and expand their knowledge base. Through a structured clinical education program, the intern will learn important practical knowledge, such as the management of acute surgical problems, but also learn equally important matters such as the importance of infection control, communication, and gain an appreciation of evidence-based medicine. Your surgical training curriculum will include many modules. One of them is the clinical module, in which we will develop your clinical judgment, clinical skills. You will learn how to bear the responsibility of infection control, managing the acutely ill, how to prescribe medicine, how to maintain your education and being updated to the knowledge pertaining to your field. Apart from the clinical module, the communication module will include the patient confidentiality, clinical note-taking, informed consent taking. So this communication module is also important, is as important as the clinical module. You will go through many of the activities like departmental meetings, MDT meetings, presentations, and this will help your professional development module, which is a significant need of the PMTC. At the end of the rotation and at the beginning of the rotation, there will be assessments. For example, at the start of your rotation, you will undergo an MCQ based pre-assessment, and at the end of the rotation you will go through an OSCE exam and consultant feedback before you declare to have adequate experience in your surgical rotation. So you will have to go through all these particular training modules during your 3-month rotation, and this is important because by the end of the rotation you should express all of those 8 domains that PMCDC has identified for a medical graduate to possess. For this purpose, we have launched Shalamar Surgical Intern Training Program, which will be run through Shalamar e-learning management system. This is a Moodle-based online system which is currently functioning for the medical students, and it will be also functional for you people as well. It has been already piloted in the previous interns. So it is a well-structured program. It has all of the important components of a good program, and if you go through, then by the end of the rotation you will have many things to possess, and it should improve your clinical as well as your research and education domains. You will have to log on to the SELMS. You will be provided by usernames and passwords by Mr. Anas Iftikhar. He is PA to the surgery department, and once you log in, you will have this front home screen, Shalamar e-learning management system. And if you go to the final year programs or hospital programs, you will find this Shalamar Surgical Intern Training Program. You will click this program and you will go inside this particular program, which is called Shalamar Surgical Intern Training Program. This is a structured program which has all of its components. It has the content, it has the orientation session, it has the logbooks, it has the consultant OSCE feedback, it has all of your MCQ exams, and finally once you are done with the whole thing, then you will be offered a certificate by the end of the program. First of all, there are a lot of content videos. These content videos pertain to surgical ethics, patient safety, transfusion guidelines, perioperative care, surgery and antibiotics, gloving and gowning, sterilization, surgical skills, IV cannulation, tube, NG Foley's, etc. their placement, stapling and suturing, appendectomy, herniorrhaphy, cholecystectomy. These are the basic procedures. So you need to know about these procedures before you enter into the program. You will be given access to this program from now on, and you will have ample time of 15 days to go through all these videos. Every video that you see, you will have to develop 2 MCQs corresponding to every video. You will have to submit those MCQs in Salim's program, and if you don't submit those MCQs, then you will not be able to go through the next module of the program. So this is very important. First of all, you will watch the videos, and based on that content you will have to develop 2 MCQs every house officer who is coming in. And once all of the house officers have gotten all those MCQs submitted, then you will be able to take a test. Okay, unless you submit the MCQs, you won't be able to take a test. These MCQs have to be made according to certain guidelines, and these are the guidelines which are available on the net in the Salim's program. So you will have to be very particular about these guidelines. If you do not go by your guidelines and you do not submit in the format that has been suggested, then your MCQs will be rejected and you won't be able to proceed to the exams. Okay, so once you go through all of those videos and you submit your MCQs, you will be eligible to go to Shalamar's Surgical Intern Training Program pre-test. That is an MCQ test that will be conducted on 13th of July 2020. Okay, and on that date, the time will be given to you prior to that particular day, and you will have to be online to take that particular test in a specified time frame. And once you are through, and you will have to pass that particular test. If you are unable to pass those tests, then you will have to retake, and you won't be able to join the program unless you have passed that exam. So make sure that you watch all of those videos, and it is important that you are safe to the patient as well as you are knowledgeable before entering and handling the patients. Okay, so passing the pre-test is prerequisite to entering into the clinical training. It is important and you will have to go through it. Okay, it is an easy exam. It won't be a difficult exam, but you have to ensure that you go by it and you pass this test. And once you pass this test, then you will be able to find a way to the next modules of this program. Once you enter into the program, then there will be a project which will be allotted to you. It can be either a research project, audit project, or it can be a learning project. These projects will be allotted to you and you will be required to finish it in a certain time period. Unless you go through this project, you won't be able to pass your surgical intern training program. Okay, so first pre-test, second is the research, audit, or learning project. During this period of 3 months, you will go through many of the presentations. So these presentations will be given to you. A schedule will be given to you by your unit doctors, your superiors, and you will have to present your thing. These presentations will pertain to either journal club, in which a journal article will be discussed, or it will be related to perioperative care or any operated case which has been recently operated in your unit, to discuss its surgical as well as non-surgical implications. So third thing is the presentation of the journal club as well as other things. So presentations and journal club, this is the third thing that you will have to go through. This process will continue for 3 months. Meanwhile, you will be learning a lot of the skills like IV cannulation, Foley's catheterization, NG tube insertion, suturing skills. You may have an opportunity to assist You may have opportunity to, you will be assisting a lot, and you will be also may have opportunity to operate as well under supervision. So you will be, by the end, you will be having an OSCE assessment at the end of your rotation. And this will assess your clinical judgment, your communication skills, your professional skills, and an OSCE exam will be taken by your supervising consultant. And once that form, which is Shalamar Surgical Intern Training Program Assessment form, is filled, then you will be eligible for further things, for certification in this. You will have to maintain your logbook. You will have to write down the dates, times, procedures done under supervision of which consultant. So you have to maintain the whole log of your procedures, and it has to be signed by your supervising consultant and your head of unit. This is important. You will have to submit these logbooks as well as the OSCE feedback form in the PDF format on Salix format. Unless you submit it, you won't be able to get a certificate. And once you have completed all of the requirements, then you will be issued a certificate which is called Shalamar Surgical Intern Training Program Certificate. This certificate will be a cause for you to take it to the HR management, and then HR management will issue a certificate related to completion of the training program. So this training program will go through for 3 months, and in these 3 months you will be learning a lot of the skills, a lot of clinical knowledge, a lot of clinical judgment skills, communication skills, leadership skills. You will be participating in many of the activities like journal clubs, presentations, morbidity and mortality, multidisciplinary team meeting for the cancer oncology. You may be going through some of the meetings that we will be conducting, like the meetings related to Pakistan Endocrine and Thyroid Surgery Association, or there may be few house officials who may be working while we are conducting the conference as well, Shalamar Annual Conference. So you will have a lot of the opportunities of teamwork, communication, and at the same time you will be learning the clinical as well as our operative skills. So by the end of the rotation, you should be having a good skill set which a graduate usually requires to be competent. This whole program has been made to ensure that you have adequate participation in all those activities, and you have adequate learning opportunities, and you have adequate communication opportunities, and your clinical skill doesn't suffer at all. Okay, so if you have any questions, you can email me. For any issues related to CELMS, you can contact Anas Iftikhar. He is PA to the surgery department. For any roster related issues, you again can contact Anas Iftikhar. In Unit 1, if there are any issues, you can contact me or Dr. Ahmed, he is a senior registrar, or Dr. Nida, if she is a postgraduate trainee. If you have any issues in Unit 2, then you can contact Dr. Sadaf Ishaq and Dr. Mahan or Dr. Dawood. They are the key persons who will be important part of your house job training. If you have any problems related to your training, related to your anything pertaining to the hospital, you can contact your head of unit, and he will go through it and he will sort it out for you. Okay, all right, thank you very much. If you have any question, you can tell me the questions. You can email me, you can ask me on my phone, so I will be available around. If you have any confusions, you can talk to Anas Iftikhar. He's a good guy and he will be available for all of the questions. Thank you very much.